and welcome to Doing Business in Rwanda. I'm Irene Birungi Mugisha. Rwanda's information communications technology landscape has evolved greatly in the last 10 years, especially after the laying of the 3,000 fiber optic cable in 2010, the introduction of the National Data Center and e-governance services, as well as the rise in the mobile telephony penetration. Rwanda's vision is to become a knowledge-based economy with information communication technology as the cornerstone to transform the country into a middle-income economy by the year 2020.
One is really looking at different ways that ICT can stimulate the export sectors and become an export itself. That's one focus. Another one is to see how ICT can improve. And it is already fueling our domestic economy in the key sectors that we talked about. And then also another focus is looking at how government uses these new technologies to be more efficient and give services to its different departments, but also give services to citizens and businesses.
Well, if I look at e-health in Rwanda, first of all, I would like to say we wouldn't be able to have what we have as e-health if it wasn't for the entire ICT infrastructure that we have in the country. Mainly I like looking at the two major backbones, the broadband connectivity that is covering all districts in the country, and then of course the mobile footprint that is covering more than 90% of the habited area in Rwanda. So that to us in health is so key because it means that 100% of our healthcare facilities report monthly and timely on all the indicators of health. So we are able to immediately see what is going on in terms of health indicators for the population. And two, it means our community healthcare workers from the villages are capable to send us on a daily basis reports about maternal and child health, the children or mothers they are following. Community healthcare workers from deep down in the villages will send to us a report depending on the status of a mother or a child that requires attention. That to us means a lot, meaning we are able to follow each pregnant woman or a sick child, any child that is under 5. We are able to follow from on ground. And then very importantly, having these two in place has helped us, have a number of web-based tools, that we use in managing health and following up our day-to-day business in health. So it's very key and very crucial.
Rwanda, according to the latest report by the International Telecommunication Union for 2012, is ranked among the 6 developing countries in the field of ICT development.
The journey started early 2000, and when we put in place our first national information and communication infrastructure plan, known as NICI, which at that time was really focusing on putting in place a regulatory environment and a conducive environment for the sector to grow, put up in institutions and other mechanisms that would enable the industry and start investing into infrastructure. So the second phase of the plan, which started in 2005, actually focused much on investing into infrastructure. And then today we are continuing with those investments, connecting the remaining places. But at the same time, we realize it is important to also focusing on services. But there is something else that cut across is the development of skills at different levels, and of course focusing on enabling government, but also the private sector.
The country has laid more than 3,000 kilometers of fiber optic cable, which runs through the country's 30 districts. The fiber backbone boosts access to various broadband services, including applications such as e-governance, e-banking, e-learning, and e-health.
Well, the benefit of the fiber optic, the intent was mainly to close the gap of connectivity. Our intention is to move from an agriculture-based economy to a knowledge-based economy, and knowledge will need those super highways of information. The benefit will become even clearer when we complete the build out. We've laid out the backbones, but we are yet to build out the last mile, the network that connects businesses, connect homes, and connect individuals. So that's what Rwanda has embarked on. For the next 3 years, we aim at 100% coverage of our country in 4G LTE.
We have a national coverage of the fibre optic. We have, I think, more than 90% of mobile phone coverage. And I was reading recently that the percentage of people, mobile phone subscribers, is now close to 70%. So when you have connectivity, the next thing is content. So I think that's where K-Lab comes in. And we've seen that local young minds are able to develop content. And the added value is that this is a homemade solutions by young Rwandans who understand the problems, who understand the local context, which is actually should be happening currently because we have a big coverage or a higher coverage in terms of network and coverage all over the country.
There is a political will to support the private sector to create content and people to develop mobile applications, multimedia content, and management information systems.
The ICT industry has been growing tremendously over the last few years, and I think it goes hands in hand with the ease of doing business in general in Rwanda and the vision that the President, His Excellency Paul Kagame, has for the role of ICT in developing, in socio-economic transformation of our country. So the sector has been responding well, and as you know, it cuts across every other domain. So it is empowering the financial sector, it is empowering the education, the health, the governance. ICT is also contributing significantly to increasing our exports. And Rwanda is otherwise landlocked, but we say that with ICT is land-linked.
Government also has plans to do the last mile connectivity, so that all our health centers will definitely have, even more, if I would call it more quantity in terms of broadband, so they can send us even more, without hassling. Sometimes they're telling us uploading a file this big, the speed is less and all that. So right now, government has plans of doing the very last mile connectivity. That will definitely make us reach all the health centers, and even the community healthcare workers can send even more than just a report of one woman and one child.
In Rwanda, the ICT is measured in the context of socio-economic development through 5 priority sectors: the governance, the health, the education, the agriculture, and the business and finance sector, focusing on tracking the use of the deployed systems and applications.
We have been making a lot of investments into making IT penetrate the education sector. You are certainly aware of the one laptop per child project, and which has reached today more than 300 schools and has gotten more than 200,000 laptops into the hands of primary school kids today. So it's really the foundation of our e-learning, and the strategy and the vision of our president is to start when students are still at a very tender age, so that gets embedded into their learning. The other thought about e-learning is distance learning and lifelong learning, allowing people to have access to education 24/7 and regardless of where they are. So there are some programs, for instance, the health sector, the Kigali Institute of Education runs a national e-learning program to upscale the skills of our teachers around the country. So it is growing, and it's becoming a market. Now we see more private sector investment coming into that. And of course, there are still gaps in terms of access to devices, and as we just mentioned, gaps in terms of connectivity, but we are addressing those challenges simultaneously.
Meanwhile, progress in e-health shows that ICT developments are an enabler for public systems.
When we look at telemedicine, of course, there is a component of having a hospital speaking to another hospital, be it in terms of, it could be one area, let's say surgery, or it can even be the lab. So most importantly, telemedicine has helped us in hospitals, healthcare providers in one hospital speaking to another, most especially where it is a district hospital needing to talk to more skilled personnel, most importantly in referral hospitals. So they exchange, for example, x-rays of patients and they consult at a distance. And then they're able to give a quick answer to the patient. But very interestingly, through the telemedicine component, we also have the e-learning. We are using the same facilities for e-learning.
As of December 2012, Rwanda's uptake in the utilization of ICT through mobile cellular subscriptions, international internet bandwidth, the mobile broadband subscriptions increased to 5.6 million, bringing more citizens connected to internet.
Today, we can see the impact of existing telecommunications technologies, especially GSM, which has been growing tremendously over the last couple of years. And I would say that generally IT has made the environment much more fluid, is enabling faster exchange of money, is cutting on the cost of doing business, and is spurring innovation and creativity among young people, and improving generally the level of service in key sectors such as government to citizen service provision, healthcare, education, and other businesses.
Mobile cellular phone subscribers increased to 53.1% in 2012, up from 41.5% in 2011.
On the other hand, is looking at products, what we call pure IT products that can be done here in Rwanda and can be exported. I'm talking about applications, I'm talking about contents. And that's why, for instance, the multimedia production becomes important, because it's a big global market. That's where products like cultural products fall in that category, and being able to monetize and export part of our culture productions. So those are things that are today possible because we've got this broadband and links to the rest of the world. We can really increase the exports, IT-based exports.
Despite the foreign direct investment, FDI, in ICT of $44 million, which are currently under implementation, and more than 4,000 direct new jobs created by the ICT investments, penetration and awareness at a community level remains at a very low level.
Well, the main challenge is what I would call mindset change. I'll just pick on one, the electronic medical record. You know, when we started and we were telling doctors, you have to start writing on your computer, typing. You know, as you consult someone, you type in what you've observed and all that. They say, no, but we are used to writing in patient file. So it is more mindset, having people understand that you can actually consult your patient and you do your typing. But it's coming. You know, we have seen some hospitals, we have, 2 hospitals that have now, they are paperless, and we are sure even the others will change. It is not just for the doctors and the other healthcare providers, but also the patients, because patients are more used to the fact that your doctor will be looking at you as they talk to you, and they will simply scribble down something. When you turn to type into a computer, they think, oh, you're doing emails. So it is a challenge, but a definitely solvable challenge.
The major challenge we're facing is the skills gaps, because, yes, in most cases, what universities offer to people is not what is needed in the market. So people need to upgrade, they need to access online resources or any other material to be able to upgrade their skills and compete in the market. Another challenge that we are facing is access to capital, where most of the guys here who have ideas, they are startups. They don't have a lot of capital. They need startup capital to be able to go far.
Giving people the confidence that you can have a local application, local software developers do something that is, up to industry standard for you. And we've, for the past 3 years, that's what we've been trying to establish ourselves as a company that can actually do that and provide good quality work. And that was an uphill battle for us, but I would say that right now we're at a stage where we are, partnering with international organizations, international businesses, and building applications for them, building applications for local businesses as well. And I feel that as much as this has been a challenge, it pushed us to try to, find ways around it, improve our skills, improve our marketing and networking, do pro bono work if that's what you need to do, just so you show that you're doing a really good job. And we like where we are right now simply because of the challenges that we faced. They made us stronger.